we have to regrettably look at more of the COVID nonsense going on around Australia. Now, I really wish we didn't have to do this, but someone has to call this stuff out. Now, as we talked about last week, pretty much the whole country is now back under mask mandates because, as we know, wearing your mask into a restaurant and taking it off at your table will, of course, save you from COVID. Now New South Wales has reintroduced QR codes barely a week after scrapping them and brought back density limits, restricting how much businesses and pubs and restaurants can do. Now, Dominic Perrottet almost single-handedly reopened this country and was rightly lauded for doing so. But this is an incursion back into the COVID craziness we all thought we'd left behind. New South Wales has changed to a 1 person per 2 square metre rule, which means that pubs and restaurants will be effectively running at half capacity in most cases. Now, this is, of course, all to stop the spread of the evil Omicron variant, which, if you considered the way all these premiers and chief public health officers have been carrying on about it, you'd think could drop you at 10 paces. But New South Wales Health Minister Brad Hazzard has already admitted that we're all likely to get Omicron at some point, which is entirely true. And he said that people with Omicron have, quote, far milder symptoms, and that the majority of cases in hospital are unvaccinated. But the problem, apparently, is that he wants to wait until everyone has had their booster shot, so the health system can presumably cope with this influx of people. So most people who end up in hospital with Omicron haven't even had one shot, but the metric he's using to decide when we can live normally again is that the rest of us have had a third shot. No one could blame you for being confused. By the way, 93.5% of people in New South Wales have been double dosed. 93.5%, and they still won't let pubs open at full capacity. I mean, what happens when the next variant comes along and is even more transmissible? Will we close the pubs till we've had our 5th booster shot, or perhaps even our 47th booster shot? Which brings me to my home state of South Australia. Now, those of you who were watching last week would know I've just come back to Melbourne after 2 weeks in Adelaide, where I spent most of my time trying to dodge these so-called close contact exposure sites so I didn't have to isolate for 7 days, even if I didn't have COVID. Just ask Pat Cummins. Well, as if that wasn't bad enough, SA yesterday brought in its own density rules, except these ones are even worse than New South Wales. South Australia has now gone back to the 4 square metre rule. Pubs and restaurants and bars are effectively only allowed to run at 25% capacity. Gyms are only allowed to have 1 person for every 7 square metres. I mean, these are the rules that were in place before people were vaccinated. And now in the great state of South Australia, they're back again. Now, I have been consistently critical of SA Premier Stephen Marshall throughout the pandemic for giving too much control to Chief Public Health Officer Nicola Spurrier, which is why I was heartened to see him be the first Premier to reopen state borders to Victoria and New South Wales and then fend off Spurrier's requests to shut it again when COVID cases inevitably showed up. I thought that Marshall had finally found the courage to tell Spurrier to pipe down and do his job, which is to lead on behalf of the people, not the health bureaucrats. I even wrote this in The Advertiser with something of a backhanded compliment, but it would seem that I spoke too soon. SA is back under a health dictatorship. The effect this will have on South Australian businesses cannot be overstated. Bookings will be cancelled, staff will lose their shifts, small business owners will again bleed money, and that is the last thing they need after nearly 2 years of hell in a state that is now 87.6% fully vaccinated. Pubs and restaurants are shutting their doors as a result because they would lose more money if they left them open. The Duke of Brunswick in the Adelaide CBD has stood down all of its staff. They wrote on Facebook yesterday, quote, "Who would have thought 2 years on this is where we would be? Even with the doors closed, we will be losing between $8,000 and $10,000 for the week. That is a massive amount of money. The South Aussie Hotel in Mount Gambier in the state's southeast has also closed its doors. They posted yesterday, quote, "Sorry, we're temporarily closed due to Stephen Marshall." New Year's Eve events will be down the toilet, and meanwhile in South Africa, where Omicron was discovered, cases have fallen sharply after just a few weeks. Hospitalisation rates have been below those seen in previous outbreaks, despite Omicron's heightened transmissibility. And that is what we're destroying businesses for.